Hi everyone, I'm Sophie and welcome to the video. Today I'm going to be running through the 7 rights of drug administration. The 7 rights are right drug, right dose, right date, right time, right route, right patient and right documentation. If you're a student nurse going on to their first placement, the 7 rights are an essential part of practice. So right 1, right drug. There are lots of medications out there that have similar packaging and similar names, so make sure you have picked up the right medication. A lot of companies will have similar packaging for all of their medications, so just be aware that some medications may look the same. An example of a similar sounding medication could be flucloxacillin and fluoxetine. They are completely different types of medication for completely different things, but you could get easily confused if you're not really paying attention or you're not checking your medication properly. Right 2 is the right dose. Medications come in all doses and doctors will prescribe a patient a certain dose based on certain things. You need to make sure you have the correct dose for your patient. If you want to learn how to correctly and safely do medication calculations, then check out my other video. I'll leave the link in the description. It's a very useful equation on how to work out any drug calculation. Right 3 is the right date. That means the expiration date of the medication. Medication expires the month after the expiration date, but there are a few different variations of an expiration date. I've got a little good practice guideline here and I will leave the link in the description. So there's a best before, use before the end, use by, discard after, and expires that date. Most medications that you will come across if you're in the hospital will expire on the date. For example, I have this cocodamol here. Don't know if you can see the date on there, but it says 08/2021. That means you cannot use this medication after August 2021. Right 4 is right route. As a student, you will not be able to do IV medication, but you can do all the others. That's absolutely fine. The different routes are oral, intramuscular, subcutaneous, transdermal, rectal, and you can have eye drops as well. Just double check that you're giving it the right route. It should say on the drug administration chart. Right 5 is right time. Do not give a medication too early or too late. Sometimes it can't be helped if you're giving a medication late. The patient might not be on the ward, they might have gone for a scan, and that's absolutely fine. But when they are on the ward, make sure that you are giving their medication on time. With certain medications as well, such as paracetamol, you cannot give it within a 4-hour window of each other. If you give a dose of paracetamol at 8 o'clock in the morning, you cannot give another dose until 12 o'clock in the afternoon. Just always make sure you check when the last dose was given. Right 6 is obviously right patient. You have to give the right medication to the right patient. In order to ensure that you will not make a drug error by giving the wrong medication to the wrong patient, always check their name and date of birth. If they can say it to you, that's perfect. If they can't, they should have a wristband on which says their name, date of birth and hospital number, so you can triple check that it's the right patient. I haven't actually done it, but I have got the medication out for the wrong patient, but because I checked their name and date of birth, I knew I'd got someone else's medication out. If you are just starting as a student nurse, you probably will make the same mistake, but it's okay as long as you don't actually give them medication. Just always make sure you check name, date of birth. The final right is right documentation. This will either be on a computerized system like what I use in the trust I work in, or you will have paper charts. They're quite easy to understand, but on your placement, just try and get to know how the systems work. Make sure you sign for every medication that you give. As a student, you'll be with your mentor or a nurse that you're working with for the day, and they'll be able to help you along the way and answer any questions that you might have. I hope this video has clarified the 7 rights of drug administration. If you've enjoyed the video, please give it a thumbs up and feel free to subscribe if you want to see more nursey content. Links to my social media will be in the description down below and also on the end screen. I hope you have a lovely day and I'll see you in the next video.